Disturbing new details released about infections in hospitals. The CDC says superbugs are to blame, 1 out of every 7, and this includes MRSA and other bacteria resistant to many antibiotics. It's a scary thing. This doesn't leave many medicines to fight the infections in people that are already sick.
Absolutely. Dr. Nandy joins us now with new data just released, and this is really scary because we all take antibiotics at some point or another.
Then I want people, when they see the story, to think about it when they go to their doctor and say, hey, can you give me an antibiotic because I think I'm sick? Remember, this has consequences. The CDC reports that at any given time in the U.S., 1 in 25 patients has at least one healthcare-acquired infection, or called HAI. So my prescriptions for superbug protection in the hospital. For me, for doctors and clinicians, isolate patients when necessary, please. Also, be aware of antibiotic resistance and the patterns in your particular facility changes. Also, follow recommendations for preventing infections. Then also, lastly, but very importantly, prescribes antibiotics correctly. Don't just give it to any person that comes in. For patients, ask doctors and visitors when they come to wash their hands before approaching and wipe down all high-touch surfaces, bed rails, bed tables, call buttons, and TV remotes with bleach wipes. Very important. So, don't be afraid to tell your healthcare provider to wash their hands. Important.
Okay. So superbug meaning that they just keep getting stronger and stronger.
Well, they're resistant to the antibiotics.
Okay.
So we fight infections with antibiotics, right? If it becomes resistant, we don't have anything else to do except just do supportive treatment. So that's important to know.
Okay, I want you to address two things. First, give us an idea of what are the signs of an infection, but also this is really dangerous if you have any kind of foreign material in your body.
Exactly. So she asked a very important question. So the sign, number 1, fevers, you can have dizziness, pain, redness, warmth, you can have swelling or pus around an incision as well as inside your body. Now, the device you're talking about, if you have, like, for example, hip replacement, what can happen is that hip replacement or that hardware can get infected, and the only treatment can be surgery. So it can really be serious because you can't give antibiotics.
Right, because it won't affect that foreign material, so it has to come out.
That's right. The antibiotics won't touch it. That's the important part.
Very dangerous.
So what else can we do, Doc?
What I would say is that be proactive. I said be your health hero. Ask your nurse or doctor. If you have an IV that's been around for a while, ask them to remove it. If you have a tube that you don't need, ask them to take it out. You've got to be proactive because it's your body. And you know what happens? These tubes and IVs can be a super highway for the bugs to get in your body and go from one to another. So important.
Dr. Nandy, before we go, we do have a viewer question as always. So a woman saw our story on toxic shock syndrome, and she wants to know, how do we avoid it?
Yeah, so it was very important. Yesterday we talked about the toxic shock syndrome. People can die from it. So how can you avoid it? Very important, easy things. Hand washing, right? Wash your hands, not just one time, but for 15 seconds at least. Keep skin wounds clean. Remember, also check your skin wounds for sign of infection and use low absorbency tampons. Change them often. People just think it's tampons, but other wound infections can actually cause it. So really important question. Please keep them coming. Don't just guess. If you don't know, if you have a question, ask us and we'll answer it on air.
All right, thanks a lot, Dr. Nandy.
It's my pleasure. Have a great weekend.
You too. If you have a question for the good doctor, you can email him at drnandy@WXYZ.com or send it to us Facebook, Twitter, email, phone call. We'll get it to him.